right, everybody. Welcome back. Thanks again for joining us. We are moving right along today. So it's a data heavy conference, but there's been a lot of good takeaways. And I believe that this panel discussion is going to steer a little bit away from the numbers and get more in depth in terms of some real life examples. And so we've got some good panelists to shed some light on that, and glad you're sticking with us. We have some downloadable resources in the window on your right side from our conference sponsor, Aesculap. So please feel free to jump in and grab some of those. You can also connect directly with Aesculap on LinkedIn. Also, you can check out our latest episode of Beyond the Tour featuring Aesculap, which is a great behind the curtain look at the production at their facility in St. Louis, I believe. So feel free to pull that up and take a watch when you get a minute. We also have some icons, and I think a number of you have already been using those today. It's a smiley face or emoji icon. So we've got a, like, love, smiley face whenever you hear something engaging or good that you agree with on the panelist side. So please feel free to use that function. I will stop my talking on all the functionality and get right into it with our speakers. Our first panelist is Sarah Vinson, who's been with us a number of times. Sarah is the Director of Sterile Processing at UF Health. She uses data-driven decision-making to help improve department operations and quality outcomes on a daily basis, and hopes to share what she's learned with others in the industry. Robbie Miller is a Sterile Processing Manager at St. Joseph's Hospital and Medical Center. As an industry leader for the past 16 years, Robbie leads with passion, excitement, and in pursuit of continuous quality improvement in sterile processing practices. Rory Burke is an instrument tracking system coordinator at VA Montana Healthcare. He is also a Golden Crown status professional and is highly passionate about finding ways to improve the safety and efficiency of sterile processing workflows. Brandon Todd is the Director of System Sterile Processing at Norton Healthcare. He is a dedicated SPD leader who strives to provide his team with the resources for long-term success. And last but not least, joining us as your host for this session is my colleague, Bobby Parker. Bobby is the VP of Clinical Solutions at Beyond Clean. He is passionate about sterile processing education, providing on-site consulting, and creating digital education content for sterile processing professionals. The title of today's panel discussion is Take a Number, Insiders Speak Out on the Current State of SPD Data. Managing and interpreting your SPD's data can sometimes feel like a daunting task. And with so many variables and data points to cipher through, it's no wonder technicians see data reports and scatter. Well, not anymore. Our panel of frontline professionals are teaming up to share their insights and perspectives on the evolving role data can have on our decision-making practices and operational strategies. Get ready to discover best practice techniques to help optimize the collection, analysis, and utilization of your SPD's data. Please join me in welcoming our panelists to the virtual stage.
All right, thanks for that introduction there, Brett. Everybody, I am Bobby Parker. I'm excited that you all have chosen to join us for this conference today. We're having a great day over here at Beyond Clean, and I'm glad that you all have decided to tune in with us. We've got an awesome panel discussion lined up for you, and if you've been hanging with us for the conference throughout, and you've been, seeing a lot of great nuggets about numbers and data and how it applies to the department, my hope and goal for this panel discussion would be to pull the tone back a little bit and just talk to some leaders about their experience with data. So we're going to bring the passion. You guys sit back and enjoy. There is a QA feature on screen. So if you, as you go along, want to include some of those question and answers, I will try to keep one eyeball on that and maybe pitch some questions in as well. And then lastly, I've seen a lot of emojis popping up on there, as Brett mentioned. The more of those you throw up, the more passionate they get, folks. So bring them on. All right. So we will get things started here by just doing a quick introduction. I'd like each of you to tell us who you are. We heard a little bit about your role, but what makes you particularly passionate about data and just having this discussion? So Brandon, why don't you get us started?
Yeah, well, thank you, Bobby. I really appreciate opportunity to come on this platform. So as Brett mentioned, I'm the new systems director for Norton Healthcare in Louisville, Kentucky. And really my passion for data started in a different route. My career in healthcare was something that I kind of fell into, not something that I prepared for. My preparation was for academics and a different pursuit. My goal in that was really looking at data from a linguistic perspective. So my training was as a linguist and kind of working through data analysis of ancient text and those things. So whenever I was going through my degree program, I had the privilege to be hired by yours truly, Bobby Parker, and join his team in sterile processing. And, they in that role kind of grew and just kind of loved kind of applying some of the data analysis tools that I kind of learned from a linguistic perspective and applying it to a kind of a raw data manufacturing perspective in sterile processing. So that's kind of my introduction to the space. And I've spent the last several years growing, leading teams, and hoping to apply the best data analysis to decision making.
Super cool. And we just heard about that that new role of yours as director at Norton, and so I'm excited to hear how that transition is kind of working into that passion for data. How about you, Robbie?
Yeah, thank you, Bobby, and it's a pleasure to be here today with all of you. As an SPD manager of a unit, a large SPD, a large acute care hospital out in Phoenix, Arizona, we're making a lot of decisions every day, really truly running a business, a small business within our facilities. We have big budgets, we have a lot of staff, we have a lot of assets on hand. And for me, the passion really comes from having objective data to make decisions. We need to remove the subjectivity out of those decisions that we are making, whether it's about finances, it's about labor, or it's about quality of processing, so that we can promote an environment where on a continuous quality improvement path, right, with respect to the instrument processing that we're doing, keeping our patients safe. And so having that data at our fingertips can really set our staff up for success. It allows us to celebrate them and allows us to really provide structure to their work to keep patients safe in that effort to promote continuous quality improvement and run an effective business in each of our facilities. And so that's really where my passion is driven from.
Yeah, I love that emphasis, and it's not uncommon to hear sterile processing managers talk about like a patient-centered vision, and that everything we're doing is for the patient, and all of that is absolutely true. And I don't want to discredit that to any regard, but it is also true that we are business managers as sterile processing managers, and having data-informed decisions about optimization sometimes is a very important competency that supports taking care of patients, because if we don't get the work done or we don't get it done on time, that's not safe for patients. So yeah, I'm excited to hear how that that emphasis on business and data will influence our discussion. Sarah, you want to go next?
Yeah, so I'm Sarah Vinson. I'm a director for sterile processing in Florida. I think my passion for data really started with an organization that was really big into lean process improvement initiatives. And so data was, or just even measuring any type of metrics, it was the only true way to know if your improvement projects or initiatives were having the impact that you wanted. So if you didn't measure it, you didn't know if it was getting better or worse. So I think that kind of started my engagement with data. I think everything Robbie said obviously is like my day-to-day job expectations, looking at budgeting, staffing, capacity, those things. But selfishly for me too, like I'm highly competitive. So like I want to be the best, and like looking at numbers and stuff is one way to like benchmark myself against, past performance. So I love anything that has to do with data. So
Sarah just wants to win.
Yeah.
No, it's good. And Sarah, you've been a guest on the podcast in the past and talked quite a bit about data, even in some of these panel discussions. So I know you've got a lot of good nuggets to share. And it's not just about winning. It's about, it's about demonstrating the work that we're doing, because like your technicians know that they're awesome and you know that they're awesome. So sometimes showing that on paper for administration goes a long way in terms of morale and just like demonstrating how awesome your team is. So yeah, looking forward to hearing about that. And Rory, why don't you introduce yourself?
All right, thanks, Bobby. I do need to quickly lead off by saying that whatever I say today, it's just my personal opinions. I'm not expressing the opinions of VA Montana, the Department of Veterans Affairs, or the federal government. But with that out of the way, big thing for me, I actually only started in the sterile processing world 4 years ago. Before that, I was a Navy corpsman, which meant a lot of limited data and doing the best we could with whatever little bit we could get. So having access to real data makes me very happy. And in my role as an instrument management program coordinator, the big things I'm looking at is where are our shortages, where are our vulnerabilities, is there stuff that we need to cut back on? Because I'm looking at, do we have trays that are turned over 5 times as frequently as other trays just because we only own 2 sets of them? Whereas the set that we use once a month, we own 4 of them. Can we make some space in the core by reducing one inventory and changing over another inventory? So that's my big thing, is using it as an inventory and prioritization tool.
Yeah, it's remarkable how much calmer 7 a.m. gets whenever you have enough instruments to go around and the phone's not ringing off the hook. So that's super important. I appreciate that that introduction. All right, you guys. So we're all here ready to talk about data. All of us have at least some perspective of passion about it. We've got a couple of directors, a manager, and a kind of data coordinator type role. So we're going to try to hit this from every angle. So here at the beginning, I just want to start off by asking a question about just access to data. How easy is it for you in your role to access your department's data? Do you feel like you have the time and the training to do it effectively, to get, I don't know, whatever data is that you're trying to get a hold of? Basically, how hard is it? And let's go in reverse here. Rory, tell me a little bit about your situation and kind of how much time you spend trying to pull data out of your department.
Thankfully, data is pretty easy to access for me because the management system we do use, our software, it's almost too readily available. Probably the biggest delay in pulling data is remembering which of the dozens and dozens of reports I can generate is going to give me the exact data I want.
Yeah.
But since it's my main role, anytime that I am called upon to do data pulling, I'm automatically allowed to just prioritize that over any secondary objectives I have for shift. So
yeah, I've looked at a handful of tracking systems in the past, and my experience sometimes with those reporting things is there are 150 stock reports, and one of them maybe pulls most of what you're looking for, so it's like so much data's out there, but it's not the one that I need, and it takes some time.
Yeah,
but
sometimes you're piecing 2 or 3 reports together to make a comprehensive report.
Yeah, no, that makes sense. How about you, Brandon?
Yeah, I would agree. I mean, I have the privilege of working in departments that have had pretty robust tracking systems over the years. So access to data has not really been a challenge. We use various platforms, and so I'm able to pull most data that I really need. In terms of time and training, I spend, in my new role, most of my days in the data, pulling reports, trying to make decisions based on those. One interesting thing about training is, I found, kind of to Rory's point, is that it's not necessarily a lack of access. It's maybe a lack of understanding of how to even utilize the tools. So I've really found a lot of success with reaching out to our project manager to say, hey, this is what I'm trying to do. This is what I'm looking for. And they're able to kind of navigate those 150 reports that you mentioned, Bobby, and kind of narrow down how you can piece them together to find what you need. So for me, access to data is pretty easy, and I'm thankful for that.
Love it. How about you guys? What about you, Sarah?
Yeah, I think with how tracking systems have advanced over the years, data is much more readily accessible than it was 20 years ago. I think one of the challenges, in addition to having multiple types of reports is understanding like the impact of filtering. So usually you can totally change the output of a report based on how you filtered it. And so I think it's important that whoever's running data has a really, really good understanding of what they're filtering out, what they're looking at, because that can, you don't want to present false data, right? Like if you're going to go to present to the C-suite on something important and you had inappropriately filtered out like a whole location or specialty or something, that's going to change your numbers. So I think the training and the difficulty with data is really understanding how to run it and making sure you're running all the correct, data points.
No, that makes a lot of sense. And you mentioned having the training and competence to do that. That's the piece of it that we often miss. We have these tracking systems that are, a very robust package and kind of the Cadillac of tracking systems, and it gets implemented, and it's kind of, good luck on your own in terms of the optimization or the operations of using it. I don't think I've ever talked to anybody in a sterile processing department who's using a tracking system and that they say they feel that they're using it to its fullest capacity. Like everybody's very quick to say like, well, we have this, but like, yeah, we're only kind of implementing it at this point. And I think that's a sad reality. So yeah, that training and competence of knowing how to filter it and use it is sometimes just as important as having the tool. Who am I missing? Rory, did you get to go, or was it Robbie? The two R's
Robbie.
are throwing me off today. Okay.
Yeah, so Bobby, I think, I would certainly echo, these folks' comments and exactly what they're saying. But I think as a seasoned leader, I've been in my department for 26 years now. I really do have the access. We've got a robust tracking system and the knowledge to extract the data that we're looking for within a tracking system, or if you're looking at business analytics or, your productivity, your budgets, those types of things. But I would certainly say, for new leaders out there, there is a challenge in developing that skill set to extract data from the applications at your fingertips. And hopefully you have a tracking system. If you don't have a tracking system, it's going to be so much more difficult. But it's important that we as leaders take the time to partner with our client managers for our tracking system, partner with our finance department, partner with OPG, so that we can really understand the software, the applications at your fingertips, because there's a lot of information in there that can help you make sound decisions within your operation and validate the hard work that you're doing. So make sure you're taking advantage of these applications. And I think to your point, Bobby, within the tracking systems themselves, they're so robust now that nobody fully understands everything. But get in there and learn and run those reports and really try to identify where you can get the information to solve the problem that you're trying to solve.
Yeah, point taken. It's a good gauntlet to throw down. Get in there, get familiar with it, and start working on it. And a quick shout out to our listeners who are maybe looking from the outside in, still doing data collection on paper. It's a tough road, but absolutely worth it. And there's still a lot, surprising amount of things that you can accomplish with paper documentation. You just have to get a bit more creative about it. All right, before we go any further, and talking about access to data and pulling from tracking systems, I want to pause and just ask what kind of data it is that we're pulling on a daily basis. There's a lot of pieces when you're talking about department data. It's everywhere. It's about labor hours and productivity. It's related to inventory, like what Rory was talking about. Even data related to the operations, like the completeness of our count sheets. So before we keep going, I want to ask our audience here about that count sheet bit. We're going to advance the slide here to a poll question you'll see on your screen. How satisfied are you with the current completeness and correctness of your count sheet data? And I will give us, 10 or 20 seconds here for us to make our selections and then show the poll results. So is your data not even close? It's all right. Feel pretty good. exceptionally well, or perhaps the most dangerous answer? That's a good question. I don't even know what our count sheets look like. Let's take a peek. All right, looks like we've got a pretty even spread, and most people are feeling pretty good and still improving. That's really important. And as we get into later in the discussion about the power of data in the department, this one in particular has just some massive potential to be able to move the operations of the department forward. It's all about, like, if you're trying to improve operations and make things run smoother, it's not about how can we squeeze more work out of these technicians. It's more about how can we make the right thing to do the easy thing to do. What can we do to make the job easier and more efficient from an operations standpoint? And man, cleaning up those count sheets, one of the quickest way to improve that prep and pack turnaround. So with that little nugget in place, I want to ask you all, what is the most important data point that you find yourself pulling on a regular basis? What is, if there's one report that you couldn't live without, what would it be in your department? Sarah, why don't you get us started?
I was trying to think. I'm like, one, I don't know that I could ever run this one.
That's right. Give us a top 5.
I'd say quality. Like, quality is really at the center of all of our conversations. You know, did we impact in any delays? Were there inventory shortages? Were there defects? Because that's a result of our overall production. So I think quality is probably our most important data capture that we have. And tracking systems do help with that a lot. But just to share, if you don't have a tracking system, like way back when I even started with, we just had something as simple as a dry erase board in Decontam that had like the top 10 reoccurring issues or things if you're auditing like case carts coming in, for example, and then all they had to do was just like put a tally mark. So it doesn't have to be super complicated collecting data. You can make it as simple as, you know, pieces of paper at assembly or dry erase board at Decontam. But, you know, if you don't capture it, again, like I said before, you don't know where you're at today and if you're, you know, getting better.
That's true. And when it comes to, you know, showing the trend line, I don't think there's a chart that your OR and your administration is going to care more about than the quality of the products coming out of sterile processing. So that's a good call out. What about you, Brandon?
Yeah, because I would agree with Sarah. I think quality is one that, you know, we're inputting data, you know, regularly, trying to upkeep that, you know, track trends and things. I would say other than that, when I was a manager, I would say the most used data that I would use would be the search feature of product usage. The number one question is, where is this product? Where is it at? We have a large network, we're sending, we're borrowing, where is it at? So that kind of, that data of the last scan point was my daily bread and butter to try to troubleshoot and find out where the missing item is. So I would say the product usage is probably the biggest report.
Yeah, that makes sense. What about you, Rory?
I'd say at my facility, the one we pull the most frequently is actually our inventory throughput, because as a medical center, we're not just servicing our OR. We've got an outpatient clinic, we've got a dental clinic, we've got radiology that we work for, endoscopy. So we, on a regular basis, we're pulling to see what our work distribution is looking like between all the services we serve. How many peel packs are we sending out to everybody? How many containers are we sending out to everybody? Do we need to refocus on a service, or do services need more equipment available?
Yeah, that inventory and equipment piece of it's really important. What about you, Robbie?
Yeah, so I think, you know, in alignment with my other panelists here, quality is probably the most important for me as well. And so specifically, you know, there's some data you look at on a daily basis, a weekly basis, a monthly basis. The one I really look at every single day, you know, having a report generate from your tracking system automatically sent to you, is really around how many instruments are missing from trays, you know, and specifically how many critical instruments are missing from trays. So we look at both of those pieces of data every morning, and really in an effort, as we as a department want to provide a quality product to our customers, our operating rooms, our patients and providers, and ensuring that we can really limit the number of instruments that are missing out of our sets. So having that report generate every day, reviewing it, taking a look, see if we can't find some of that stuff or what actions we need to take because that instrument is not currently in the set is probably that one piece I look at every single morning.
Mm-hmm. Yeah, no, that's really good. And that missing instruments, issue, or sets complete with instruments missing out of them issue is one of those monsters that if you keep in the closet, it just keeps growing. You know, like the orange, this item's missing something, stickers just keep multiplying in the department. And so I love that approach of daily taking a look at that and trying to actively manage it and keep that list down. In the department that I manage, that was actually one of our quality metrics, is keeping that number of trays missing an item under a certain threshold, just because we saw that as a patient safety issue. We don't want the OR getting trays that have items missing out of them. So yeah, that's a good one to set a goal for your department on and take a look at every day. And it doesn't necessarily have to be the manager to do it either. You can get some champions out there for missing instruments in your department and hand them that list every morning and send them on a hunt at the 6:30 time before those 9 a.m. Cases start rolling into decontam. You maybe have a little bit of time to try to find some of those. So that's really good. I appreciate you bringing that up. So the title of our panel discussion today is Take a Number, Insiders Speak Out on the Current State of SPD Data. So tell me about what you think the current state of data is just across the industry, or maybe more specifically in your department. What are the biggest gaps in terms of having the data that we need to run our departments effectively, or maybe from a frontline technician perspective, even just to work effectively in the sterile processing department? And I'm going to let you start off again, Sarah.
I mean, I think accessibility to data is there. I think our challenge, if you're using a tracking system, so I don't want to, discredit those who don't, but for a tracking system, usually it's lack of compliance in utilizing for scan points, for example. So like if we're tracking inventory or inventory usage, like we have significant issues or gaps in data related to just people not utilizing the system to its fullest. I think our datas and our dashboards and reports are far superior than they've ever been before. So I don't think getting the data is the challenge. It's again, making sure people are utilizing it to its full ability, that we're understanding it, the training that we've already kind of talked about. But I think the information's there for anything that you want to tracking system or otherwise. It's just knowing how to pull it.
Yeah, and Sarah, you've mentioned a couple times that a lot of the decisions that you're making at the director level are related to the data that you're getting out of these tracking systems and trying to benchmark everything. I'm just curious, from kind of the director's seat perspective, how do you go about creating a culture and a department around you that embraces that approach? Technicians who are interested in the data, and that's not just like, oh, there goes Sarah with her charts again, and like she doesn't understand us in the real world. She lives in chart land. Like, any advice for just implementing data well in a sterile processing department?
I think having the technicians be part of it, right? So if you're going to set up a department KPI dashboard or daily managing like improvement board, like ask them what's important to them. Like, what do you want to see? Do you want to look at like staffing, or, because, people complain, I'll say complain, or voice concern about we don't have enough staff. Okay, well, let me create a dashboard that shows how many staff we had versus how many trays we produced, backlog, et cetera, to kind of paint a picture. So then it takes the feeling and emotion out of it, right? And I think that's, if we make decisions based on I feel, we had one bad day, like that's not a really good way to make decisions. The OR had one bad day and they want me to buy like this really expensive piece of capital equipment. Well, let me run reports to see, well, how often have we had that bad day? Was it just once, or is this a reoccurring trend? Looking at usage. And again, it takes that feeling and that emotion out of, okay, it just was a bad day. And if we make decisions based on data, it's an easier argument to win.
Yeah, no, that's really wise. And I think it just touches on one of the big gaps out there. Like you said, it's not necessarily a lack of availability of data. It's just, how are we operationalizing that, and in a way that is moving the department forward together and is not not just a top-down crushing of data, meet these numbers or else kind of thing. Brandon, you got anything that you want to add on just the state of data and sterile processing, what some of the gaps are out there?
Yeah, sure. Yeah, I agree with everyone mentioned. I think access to data, especially for those departments that have, a tracking system or different methods of, collecting data. I think one of the challenges I see kind of in our field is because data is very valuable in our world. It's kind of becomes proprietary to different companies, and therefore then you start to see these data silos where you have this massive amount of data and just incredible tools which could be utilized very effectively, but they're kind of behind a paywall, or they're behind, they're kept within my department. We don't share our information with other departments. So I kind of see data silos as kind of an opportunity and a challenge within our industry, because there are tons of questions and tons of things that I encounter. I would love to get access to more data, but with my limited sample size of one department, I just don't really have a lot to go on. So I think that's one thing as an industry. I think the opportunity to sharing data, being more open with kind of what's going on in each departments, and even some of these, our vendors and those different services of our industry.
Yeah. So that is a big gap. And Brandon, I guess if you were industry king for the day and you could wave a magic wand over this whole thing and fix it, I guess you're a wizard king. How would you go about addressing that silos issue? Like what does an ideal future state look like in your mind?
Oh, that's a great question, Bobby. I would say just I guess, because I do understand that there is a proprietary nature to a lot of data. If your company has invested resources to collect data, you're not just going to hand it out for free.
Right.
But I think there could be opportunities if I were, let's say king of the SPD universe for a couple of days. I think just kind of finding ways to integrate, key data points that would be useful for everybody, and to kind of have like a public platform which could, you could submit your data to. I know there are a few companies that are kind of trialing out that, kind of peer edited, like, hey, I know there's one out there with instrument IDs where you can upload your own pictures and your own, descriptions to the platform. So something kind of like that at an industry level would, I think, be useful. The challenge would be, what data do you want? What data do you need? And you would really have to have, a pretty big figurehead to kind of try to cast that vision to know what data you would really want to submit and need to collect.
Yeah, no, that makes a lot of sense. Any of you listening out there, if you've had a lot of success with using some kind of benchmarking tool or comparing data from another department that meant something to you and helped your operations, go ahead and let me know in the Q&A feature, and maybe I'll spotlight it for us while we're talking about this. Robbie and Rory, anything you want to add to this in terms of just seeing gaps in the data and sterile processing?
Sure. I have a few gaps that we've certainly identified, and as a data-driven unit, there are always gaps. And I think to Brandon's comments, national benchmarks are one of those gaps that we don't have. Amy does have a great benchmarking tool. I know you're looking for those types of responses, Bobby. And if you haven't looked out at the Amy benchmarking tool, there's some great information there that can help you get some benchmarking, but those national benchmarks are absent, and really so we're in a position to benchmark against ourselves or with our own hospital systems, right? I think another big gap that we don't have, even with tracking systems today, is really understanding underutilized instruments. And that would be really something that could help us further promote efficiency within our departments, and really being able to identify within our trays what instruments aren't being used the majority of the time. Can they be removed? But we don't really have a good way to collect that data. It's very much a hardship, which is part of data. How can you actually get the inputs to get the outputs, and what are you doing with that data? But the ability to really understand what instruments are and aren't being utilized takes an enormous amount of work, and we really just don't have that information in many of our facilities. And then to Sarah's point, I think quality is always the big KPI and those dashboards. And again, some quality events that we might want to look for a benchmark against, it can be difficult to obtain the data because we might be relying on a large group of people to actually get those inputs, whether you're looking at holes in wrappers or bioburden events, or how are we reporting those things in order to actually get good quality data to act on. So I think those are some of our gaps that we're experiencing currently in the industry.
Yeah, I would agree with all of those. Rory, you got anything that you want to add to this discussion?
Yeah, actually, I think it's because I'm looking from a floor level rather than a manager's level. I'm looking at different data, and I'd say one of the biggest gaps or issues I run up against is a buildup of junk data, because maybe you've bought the same instrument from 7 different companies over the course of your time, and as you retire some of those lot numbers or part numbers, maybe they're not getting removed from your system. And also maybe at some point you had somebody putting in data who really shouldn't have been putting in information.
Yep.
I've run across instances where I've got the same part number in 4 times with mild variance, because the person wanted to enter it per location rather than just entering the item. So you run up against trying to sort out what data is real and what data is just absolute garbage that's showing up because there's some ghost instrument in the system that's still reporting.
Yeah.
So I think that's the biggest barricade I've run up against.
You've got the same model number, but one's with a dash, one's with a dot, and one's with a space, or one's your 6-inch mosquito and one's your mosquito 6-inch, and so forth. I've definitely run into that, and that is a really big category. Before we dive further into that, quality has come up a couple of times, and I just wanted to ask this group, as I'm sure there's some disagreement out there in the industry on it. When you're measuring quality data, what kind of data points are you gathering? Is that only the feedback from the OR, or is it anything internally? Do you weigh those two things differently in terms of, does the OR's feedback, the ones that made it to the patient, does that count more than the ones that you found in the department? Like, how do you go about coming up with that quality number in your department, I guess is what I'm asking. And I'll just throw that generally out there for whoever wants to butt in and answer.
I'll butt in.
Yeah,
Just
go ahead.
if you're talking about the difference of defects identified within the reprocessing space, I have historically counted that separate to highlight, again, back to like staff engagement, to give them kudos for like, these are all the great catches that we caught and fixed. And so like those were, things that could have gone to the patient, but we were able to fix them. So that's like a different bucket of, I would look at total defects caught versus total assemblies, like what percent are we, our defects are making it through processing. And then to the patient, that is looking at how many cases or patients did we impact. So total defects reported within the OR, what made it past us. And so I actually like to look at that a couple different ways. Cases is the patient, so that's the most important. But if you really want to look at some statistics on your defect rate, I like to look at, well, how many trays was that? And then even further, well, how many instruments was that? So if I have a 5% case defect rate, but a 0.0001 instrument defect rate, because we're processing 1 million instruments, that number is very different. And, and that helps speak to the staff, like, yay, 5% seems horrible that we impacted patients, but just so you guys know, I know that you count millions of instruments every day, and really our defect rate is this. So it's some of the data is your audience. I present the case data to the surgeons and the OR staff, but to my staff, I'm looking at trays and instruments, like their production, because that's what they control and impact. So.
Yeah, I think that's really wise to split those two numbers out in terms of who that's being presented to. I've always wrestled with, at the technician level, like if we find a tray with a defect in it in sterile storage through one of those great catches, whether you've got an internal quality program or something, I guess either way, that tray was a patient-ready tray that was going to impact a patient, and just by happenstance or luck of the draw, we happened to find it. And so I've always wrestled with what do we do with that tray, because I do want to celebrate the technician or whoever caught it, and I do want to bring that up internally. And sure, maybe that doesn't end up and belong on the report that goes to the OR that shows number of patients that we've impacted, but I often wondered what what we should maybe do with those trays at an elevated level to say, like, we said this was safe for a patient and it wasn't. Anybody else have any thoughts about that?
Yeah, I'd say without a doubt, just like Sarah's, you do need to break it down. And some quality metrics that you're looking at are going to be kept internally, and some are for, you're reporting out to the operating rooms, you're reporting out to the C-suite, that type of thing, as you're establishing unit KPIs. So without a doubt, for example, bioburden, right? When bioburden events occur and your instrument assembly technicians identify that something didn't get fully cleaned, that's different from the bioburden rate that it hit the operating room. We had to break down a table, we had to delay care, right? And we need to separate those quality events and how they're reported. And so, the first one, when it's in the unit, that's how we can coach our staff and support our staff, and even celebrate our staff, evaluate our staff, versus the metrics that we're providing about our business and how it's supporting, our surgical procedures and keeping our patients safe within the organization. So you do want to be mindful about when it's appropriate to report, and then what events you're really going to focus on as key performance indicators and quality initiatives for whatever period of time, whether that's for the fiscal year, ongoing permanently. We're going to focus on this for the next 90 days, whatever it is. But you got to break out your data and make sure it's really focused.
That's really helpful. Just thinking about how we practically manage that and what we're going to do with our quality data. Definitely something worth thinking about. If you're not currently tracking your data for quality out there and presenting that, even if the data does not look so good at the moment, it's best to start with some transparency somewhere, just so you can show the improvement. So I appreciate you guys pinging in on that. I want to leave space, because we've got about 20 minutes or so left. I want to leave some space to talk about some success stories. Have any of you got stories of how, whether you just entered a new role and are kind of in the process of implementing this, or have had some success over time using particular department data to bring about some important cultural change, and what some of the benefits were from that? So anybody have a story they'd like to share with us?
I've got a story. I share two quick stories. So again, I've been in my organization a long time, and probably around, I want to say 2010, we actually really started tracking immediate use steam sterilization. We did a very poor job of it prior to then. And so now, 13 years later, and this is one of those metrics we don't have national benchmarks for. So you're really focused to, set a goal for yourself, start with that baseline, and then it's a journey to zero, right? That's what we all want to do, and really focus on your effort to reduce that practice and hopefully eliminate it one day. And by actually utilizing the data, we've been able to effectively monitor the immediate sterilization to where back, 15 years ago, those rates were really, really high in some units, above 30% IUSS rates. And today, 15 years later, we've actually been able to reduce that every single year to now we're below 1%. And it's really about using that data, what's going in there, how often it's happening, do we need to buy more sets, what's causing it, taking that information so that you can affect positive change. And then I'd say on the flip side of that, with tracking systems, we've successfully transitioned our metric for labor productivity from OR minutes to items processed based on complexity level. And this is simply by using a tracking system effectively and working with your finance department to have business analytics run those reports and really have a much better metric to appropriately staff our unit based upon the volume of instruments that are coming through, rather than based on a metric that doesn't incorporate everything that we're doing, like clinic instrumentation or non-perioperative areas, which I think many of us are probably processing instruments for those units within our campuses that aren't in surgery. And so both of those things have been great successes for us using data.
Yeah, those are very powerful stories for sure. And just to touch on that department productivity one, I don't think anybody's happy with their productivity metric in their sterile processing department. And I've heard some that are far crazier than OR minutes. Even I think I think the craziest one I've heard so far is patient days, just like patient census days in the whole house. Like what? That doesn't even have anything to do with surgery, let alone the instruments that are coming through the department. There's sterilizer loads I've seen used, and a number of others. And so, how did you go about using that department data to get to the place where you could do items processed, adjusted for complexity?
Yeah, so first it was about breaking down silos. I'm part of a very large organization, largest nonprofit system in the country. And so, we built a task force to break those silos down and really establish benchmarks using the AMI benchmarking application for what complexity level, what that means as far as how many labor minutes are required to process the different devices you're doing. When you have very complex trays, you need 75 minutes to do those trays versus peel packs are about 15 minutes. And that incorporates your decontamination, your assembly, your sterilization, your delivery process, right? So establishing those benchmarks, getting buy-in, having, a champion at the system level to support you, and then partnering with your tracking system client managers, your finance department to really, define how it's going to work. So that the information can be pulled automatically from your tracking system by your finance department and those applications that you're using to effectively track how many sets are coming through your department on a day-to-day basis. And then it was really just about having that support at the enterprise level by, working with all of our colleagues, both within the SPDs and our perioperative leaders, to affect that change. But it did require the use of a tracking system. And so,
Right.
And really standardizing a tracking system as well within your enterprise.
Yeah, I think when people look at that undertaking, because I think we'd all like to be in that state of, everything that we touch in the department is counting towards productivity, and it's adjusted for complexity so that, your open heart tray doesn't count the same as a number 3 knife handle peel pack. We'd like to get to that, but it can be a bit intimidating when you think about creating those complexity levels and in your tracking system in a way that would represent appropriate benchmarking and that your administration would be pleased with. And then how do you go about the collaboration across departments to start having that discussion? So that's definitely a big win for you guys. Have you felt the impact of that just in terms of getting the staff that you need and having your productivity reflect what you're actually doing?
I wouldn't say we've necessarily felt the impact yet. We just went live with it at the beginning of our fiscal year on July 1st of this year. So, we're a couple months in and we're seeing, but it's going to have a very positive impact because it's just a much better metric than OR minutes or, God forbid, you're on adjusted discharges or something like that. It seems to be the best metric to truly capture what kind of work is coming through your department.
Yeah, no, that's really powerful. We are here at the 7th inning stretch, if you will, and I want to shift the discussion towards the particular management of individuals. Like, how do we think about productivity and quality at the technician level, both what kind of data the frontline technician might be using, or how as a leader we might be using that data to help improve the performance of our technicians. So before we jump into that, I want to throw another poll question to our audience here. And this one says, how easy would it be for you to find out how long it's taken X employee on average to assemble a major ortho tray over the last 12 months? So particular tray, last 12 months, how long does it take on average for a particular employee to assemble that tray when just evaluating their performance? Just a few clicks and you'd have it. You might be able to find it, but you're going to have to call some folks first and figure out which reports to use. You're not quite sure if you could find it, and if you did find it, you wouldn't trust the data anyway, or don't have a tracking system, or if you have one and you just don't think you have that functionality, you could put that in there as D as well. And I think this is an important discussion, particularly when we talk about technician performance and it comes time for those performance evaluations and annual reviews, and you're sitting down with people, particularly if you're in a pay for performance type of setting, and you need some data to demonstrate the people who are really exceeding or those that need some improvement. Being able to pull things like this is really useful. So I'm curious to see how people are doing with that. Here is our Results. Wow, I'm really impressed. We've got almost half of us, just a few clicks, and I would have the data. That's awesome. And then we've got a pretty big constituent down here at D as well. We don't have a tracking system, so that would be pretty impossible to do. And yeah, timing sets in particular, I don't think standing there with a stopwatch, double teaming every tray would be a sustainable method. But I'm curious from you all, at the technician perspective, how much stock do you put in timing, assembly, and judging technician performance based on that individual productivity? And I guess we'll start with Brandon and Rory. What do you think about using data just at the technician level and performance and productivity?
Yeah, certainly. So I mean, I'm a big proponent of getting as much data as possible. So I do like to, when I'm doing performance evaluations, try to get down to the technician level of their performance, their output, their quality, all those metrics. I will admit one of the challenges has been that the data is imprecise. I'm sure many of us have clicked the button, what's productivity for Sally, and who's your highest performer on the department, and you get like a 22% productive number. I've had a lot of that pass through our database. So one thing currently we're looking at improving that, just kind of adding some labor standards. So historically, because I don't have that, I would be the category of B. I could find it, but I'd have to call some folks. So what I've done, I've tried to kind of marry, kind of just average output for the department, trying to look at some industry benchmarks, and then kind of putting each technician up against that benchmark to kind of judge them. So it's imprecise and it's not perfect where I like it to be, but we're making progress to get there.
Yeah. I like that answer, and not necessarily putting all your trust in that particular number. An attendee comment came through here saying that, the problem at looking at that particular data for assembly time is it doesn't always capture the challenges like damaged instruments or replacing missing instruments. And then whenever you have those kind of average ideal assembly times, that's assuming that the tray is perfect, it's complete, you don't run into any issues along the way. And so to your point, Brandon, like zooming out a bit and understanding the context behind, it says that we're only 22% productive. It definitely shows the need there to create some space for some of those kinds of things in the department and not get hypercritical about, one tray on one particular day, taking a particularly long time. Rory, you're probably of the group closest to the front lines and probably have the most recent experience, hands-on technician assembling those trays. What are your thoughts on using individual productivity numbers for measuring performance?
I'd say there is some merit to individual productivity numbers, but personally, I'd argue assembly time is probably one of the ones I put least stock in when I'm looking at my team. Okay. Simply because your senior techs who have worked with the same trays for years and years and years aren't necessarily going to be scanning it into the system when they start assembly. They're going to assemble that tray from memory, scan it into the system, click the count sheet off, print the count sheet, be done. So they assembled that tray in 7 seconds, not because right. It took them 7 seconds to assemble that tray, but because they took it off the rack, built it, and then built the count sheet. Honestly, the metric I tend to pull when my team's being reviewed for our productivity, because I'm actually still a floor level tech on top of it. I still do the assembly, still do the decon, but the one I found the most value in so far is, at least in our program that we use, we can track on top of number of trays assembled, it's how many instruments, because maybe somebody assembled 63 trays in the day, but they were assembling dental cassettes that only had 8 instruments in them.
Right.
Another person only assembled 17 trays, but they were doing all our ortho cases from the day.
Yeah.
So,
and then you get the other extreme of the person who does all the small frags, and they only get through like 7 trays for the day, but they've done 3,000 instruments because of all those implants in there. Yeah, for sure. No, that's really good. Guys, as we are wrapping up here, it never feels like we have enough time for these discussions, even though we booked an hour for it. I want to take a look towards the future. We talked a little bit about gaps, and I pressed a couple of you all on, how do we fix those? But what do you think is kind of the emerging trend for data and analytics in the sterile processing department? And what are some of the things that you would like to see the industry adopt long term to help make our department safer, more productive, more efficient? Anybody who's got a great idea, feel free to jump in there.
So I think one of the emerging trends that's coming out is artificial intelligence. Artificial intelligence within our tracking systems is something that's growing. I know our tracking system manufacturing partners are doing a wonderful job getting really creative about how the data inputs going into the system can be pulled back out in ways that is helpful for us to lead our units. And so to continue to see that artificial intelligence grow. And, when I was talking about, for example, the underutilized instruments, I'd love to see, the systems get to a point where a camera can just quickly look at a tray and see which instruments were pulled out of it or have been put inside of it, that type of thing, to help us identify those underutilized instruments. But the data itself, based on at the individual level and the unit level, there's some really wonderful technology out there with these systems using artificial intelligence. So I think that is definitely one of the areas that we're seeing some improvement on.
Yeah, and there are some companies that are actively working on that right now in terms of using computer vision and intelligence to help with that utilization piece. Because right now, if you've got unoptimized trays and you're only using 30% of what's in your trays, it's a heavy lift to try to get to the surgeon and the OR team and figure out what aren't we using anymore and plucking those out of there. So yeah, that would be a tremendous help having that. Any other ideas of what you want to see from data and sterile processing in the future? Jesse from our listeners adds in about kind of that adoption of computer vision and robotics and AI, that it's important to consider that that's not ever going to take the place entirely of a skilled sterile processing technician assembling the tray, because that inspection for cleanliness and all of that you might be able to do with some fluorescent imaging or something like that can't compare to somebody who's function testing that tray and has the critical thinking abilities to be able to both function test it and clean it. So I appreciate that call out. And Robbie, correct me if I'm wrong, but I think more of what you're proposing is something that'll help us evaluate like which ones are being used so that we can more intelligibly optimize our trays, right? And have the ones in there that the surgeons need every time.
Well, absolutely. I mean, that's an extreme version of artificial intelligence, having that vision capability that could quickly look at a tray and determine what is missing from it, that kind of thing, to help the technician. That comment's absolutely correct. Our technicians are going to be vital, but AI on a much more simplistic term can help us in so many ways. It could look at your system and say, hey, we're not utilizing this tray very often from a needs projection rate. Maybe this could be reappropriated as you're building new sets. There's instruments in this tray that you might need as you're modifying another tray. There's lots of ways that the AI, the data within the system, can be presented back to us in order to optimize our units and the assets that we have on hand.
I love that. Well, you all, we are right at the close of our hour, so I'm going to wrap things up here. I just want to say thanks for jumping on and sharing some of your perspectives, some questions I threw at you on the fly, and you guys have been wonderful panelists and sharing your experience with us. And I appreciate some of the calls to action as well in terms of diving into your reports, figuring out how they work, getting the help and the training from whatever vendor has supplied you that tracking system and making it happen. Some tips in there about how we can implement well our data collection, even without a tracking system, whether it's using tally marks or count sheets along the way. And then what what we need to do, particularly related to quality and technician performance, to make our departments excellent. We really can achieve a lot through data. And as you all have mentioned, it's not the lack of availability of data out there. It's, do we have the training and the time to be able to analyze that data and keep moving it forward. So thank you all for an awesome discussion. For our listeners today, I want to say thanks again to you for hanging in there and for throwing us so much love through the poll questions and the emojis. There are a couple of questions that came through that we didn't have time to get to. I want to encourage you to reach out to each of these folks through either their LinkedIn profiles, or you can find their contact information directly in that speaker bio tool on your screen. Or if even you just want to ask, like, hey, what do you think about this particular tracking system? These 4 folks will be great people to ask about their experiences with those. So feel free to reach out that way. If you're in it here for the CEs, you'll find that available in the downloadable resources window on your screen. And with that, we're going to take another brief 10-minute break here before the next session. So thanks for joining us, and we will see you again here shortly.